Welcome to Red Carpet Healthcare Solutions, hosted by Dr. Ryan Mawley and Travis Bozell.
Without further ado, Dr. Moby Parsons.
Welcome.
Thanks so much, guys, for having me. I'm honored to be on the show. And Ryan, I've certainly followed you on LinkedIn and all the great stuff that you've been doing down in Pennsylvania. So congratulations to the success that you've had. And I know we share a lot of the same interests when it comes to transforming musculoskeletal care in these somewhat challenging times with the way healthcare is going.
Obviously, your entire career has been private practice. I'm about as staunch as they get. I mean, I have a podcast with my buddy here called Private Practice Podcasters. So you're not going to find somebody that's an advocate more for private practice than myself. What is it with you that has kind of drawn you towards private practice, and what do you think are some of the main advantages, and what has kept you in private practice this long of a time?
A lot of the big payers and the big insurance companies are, they're certainly giving pushback on that because they want to try to reduce that as much as possible.
No, 100%. And like when these companies are working as a TPA for a self-funded plan, they're sort of caught in this funny world where they do want to save money for their employer, but they also want to sort of, incentivize themselves through commissions and things of that nature. And so, it's like a funny sort of situation where they have competing agendas.
Do you want that 1-2-man group? Do you want that mid-sized group? Or are you looking to join that super group? And I think there's advantages, disadvantages to each of those. But I really like the model that you've kind of created where you've really made it lean and mean. And you were able to successfully kind of unwind it from where you were with 60 some employees with just outrageous overhead, which is what a lot of these groups are experiencing.
Yeah. I mean, the other nice thing is because my partner and I pretty much do the same thing. He doesn't do shoulders anymore. He used to do some. From a resource utilization standpoint, our practices have the same needs. You know what I mean? So it gets you away from those conflicts that groups can get into, particularly 5 years ago when joints weren't being done at ASCs and the sports guys were like, really killing it at the ASC and the joint guys were taking everything to the hospital. And it just created a lot of strife in these groups. And so for us, it's nice because we don't really have to compete with each other. We both, been doing this long enough that we have our own practices and we can really kind of standardize the way that we do things in terms of delivering the care. That just makes it easy for the people in our office to know that we kind of do it relatively the same way with a couple of minor twists, but not much. And that just makes the day-to-day operations pretty easy.
I think and I don't know, Dr. Parsons on your side, but we've received like a ton of feedback and people reaching out that are like kind of at that crossroads right now. Like, okay, I think I want to go to private practice, but there's the burden of this and that. And maybe this just seems easier to go this route. Like if you were talking to somebody who was like at that crossroads, right? Like I think, and it's kind of funny now that I'm looking back at the catalog of all of our episodes, like the bundle payment thing we're talking about now, like that to me is just like a key component of like succeeding, right? And you don't have that option, right? When you have those kind of, you're tethered to that hospital or that health, you just have a lot less autonomy, which I think is the ultimate theme of private practice, right? Autonomy, in order to kind of get to where you need to be. But if you were having that conversation with somebody who's like, Dr. Parsons, why private versus employed? Like what would your message be to them?
Well, alone we can go fast, but together we can go far. And, I just want to thank you, Moby. This has been a lot of fun. I now have your cell phone, so look out because I would love to connect with you maybe off the record a little bit more and just share a little bit more of each other's experiences. I want to hear how you like that wine too, by the way. So
I'll have my wife text you later.
Smell of breath. That'll be the closest you get to tasting it. But and for all of our guests out there, I just want to thank you for tuning in. All right. Have a great night. See you soon.